Hi, my name is Marina Kuperman. I'm a nurse practitioner specializing in women's health and gynecology. Today, I wanted to discuss infertility. It's a topic that's very dear to my heart. It's something that I personally have experienced, so a lot of women are going through issues with fertility and don't necessarily know which questions to ask, how to go about addressing their questions and concerns and issues as they pertain to fertility. There really is no preparation for pregnancy as long as you maintain a healthy body. If there are any issues that you have, whether it's issues with thyroid or whether you have anemia, it could be just something as simple as starting to take a multivitamin or a prenatal vitamin 3 to 6 months before you plan pregnancy, just to get some of those nutrients. Folic acid is great for brain and spine development, and the more you have, the better it is for the development of pregnancy. Mother Nature didn't intend for us to have children later on in life. Our grandmothers and our great-grandmothers, for the most part, had children in their younger 20s. Now, with society, with changes in society, women are more career-oriented. Women are trending towards having children later on in life. Mother Nature didn't intend for us to do that. She didn't want to give us that flexibility. And that's why the older we are, the more difficult it becomes for us to get pregnant. I like to make things very easily understandable for people. So I have a very easy analogy for certain issues that I find works very well with my patients. So every woman is born with a certain amount of eggs in her ovaries. You cannot accumulate any more eggs than what you're born with. I can't give you mine. You can't get them. You have what you have. And from the time that you're born to the time that you start to menstruate, which is usually around 13, those eggs mature, your hormones mature. And when your body deems that you're ready to ovulate and utilize your reproductive organs for reproduction, that's when our cycle starts. And so ideally, textbook scenario, ideally every month, every woman, when we get our cycle, our uterus, which is the kind of like the home for the baby, where the baby grows for 9 months when we do get pregnant, the uterus cleans itself out. Your lining cleans itself out to prepare for potential pregnancy, because that is the reason why we have a uterus and ovaries. They're reproductive organs. They're given to us for purposes of reproduction. And so from the time that we're about, let's say 13, every time that we ovulate, we deplete that reserve. We deplete the reserve that we were born with. And around 45, 50 is when women typically go into menopause. So what happens is, once we have depleted our reserve, those eggs that are not utilized, that we don't use to get pregnant, they disintegrate. Our body flushes them out, and we can't save them in any way. Around 45, 50, when a woman's body starts to prepare for menopause, it has to do with the amount of eggs that you have left in your ovaries, which is your reserve. So a lot of patients ask me, is there a way to check that reserve? There is. There's a hormone, there's a blood test that can be done, but it doesn't tell me she has X amount of eggs left in her ovaries. It gives me a range, whether your range is low, normal, or high. And I'll talk a little bit about what those numbers mean. Usually women who are closer to menopause or are going into menopause, they tend to have a low reserve because they've already utilized most of their ovarian reserve. Usually women who are in their 20s, between the ages of 20 and 35, they have a normal reserve. And that means that you still have a lot of your eggs that you can utilize. After 35, our reserve tends to decline significantly with every year as we get closer to menopause. If you have a high reserve, usually that indicates that either someone has been on birth control for many years and they have a high reserve because they typically don't ovulate on birth control, or Issues like polycystic ovarian syndrome, if you've ever heard of it, is one of the main reasons why women typically have anovulation or irregular ovulation. The first step to understanding whether or not it's going to be easy for you or it may be a little bit more complicated for you to get pregnant is to understand what your reserve is like. That's the baseline for you to know what you have to work with as far as your reserve. So fertility can be just as simple as timing ovulation. Ovulation usually occurs mid-cycle. So when we menstruate, our uterus cleans itself out, it prepares for potential pregnancy. Once ovulation occurs, once the sperm and the egg come together and they implant in the uterus, that's where the eggs start to develop into a baby and they grow for 9 months. And one of the common issues that women have is simply just as simple as timing your ovulation. There are many different things that can be used to monitor ovulation. Some women feel their ovulation, they feel a strong, sharp pain on either side of their pelvis, accompanied by changes in their discharge. Some women have a little bit of spotting mid-cycle, which is also indicative. It's called Mittelschmerz. It's indicative of ovulation. Some women use ovulation kits. And one thing that I always say about ovulation kits is that when you do a pregnancy test, you either get a positive or a negative pregnancy test. With ovulation kits, it's a little bit easier to get a false positive because the ovulation kit is detecting a hormone that we constantly produce. And so the key is that you're looking for those two equally bold lines because you're looking for the surge of a particular hormone that is responsible for releasing that egg out of the ovary. So what I do, one of the services that I provide at my practice is fertility monitoring, and it's a more detailed way to understand where you stand in terms of your ovulation. So we start the monitoring in the beginning of the cycle, where we get a baseline. We need to know what your hormones and what your ovaries are doing in the beginning of your cycle. That way, every subsequent blood test and every sonogram that we do thereafter for that cycle, we have something to compare to. We can go back to your baseline. So in the beginning of the cycle, we can monitor, or you can go, when you go to a fertility clinic, when you do fertility monitoring that is outside of just using the fertility strips at home, this is what we look for. So we look for, in the beginning of the cycle, the baseline as to where your hormones are and what your ovaries look like. What it looks like as far as the immature follicles, that one of them will potentially be the dominant follicle that will ovulate. Then we compare that mid-cycle and we see what the changes are. We're looking for certain changes in hormones that will allow the egg to be released. When we do an ultrasound, we also check to see whether or not there has been development of that dominant follicle, whether or not it looks like there's going to be a follicle that has either ruptured and released the egg recently or looks like it will within the next couple of days. And then at the end of the cycle, we check the hormones to see whether or not an ovulation has occurred. So this is a very detailed way to monitor fertility if it's something that you're interested in. If you've been trying on your own for 3 to 6 months, if you've been using the ovulation kits and you're still not getting pregnant, this may be a great way for you to understand when you ovulate, whether or not you do ovulate. But as I mentioned before, it's a good idea to start with checking your reserve. There are numerous amounts of medication that can help you stimulate ovulation in the event that you don't ovulate on your own for whatever reason. But those are things that you can discuss with myself, with your doctor, to see what those options are. If you want more information on how to reach me at my office, you can call 718-355-9705. You can also email me at familyhealthfnp fertilitymonitoring@gmail.com. If there's anything that I can help you with, feel free to reach out. I hope to see you next time.